No.
prostate cancer, and who is the main victim, particularly which person can affect this cancer? See, prostate, this is a gland. It's a walnut-sized gland, walnut, that they try to walnut. Yeah, and it is under the bladder, that is located under the bladder. It produces some fluid, semen, fluid comes out, and the size is 4 by 3 by 2.5 centimeter. That is the size of prostate gland. 4 by 3 by 2.5 centimeter is the size. This is measurement of prostate gland. And weight is around 20 to 25 grams. This is the most common cancer in men after skin cancer. Skin cancer is the main, and then second is prostate cancer in men. And particularly this affects after 50 years old. Below 50, rarely you can see this type of cancer, prostate cancer. So initially you can't see any type of symptoms. It grows gradually. So you can't feel any type of symptoms initially, but later on aggressively attacks on the gland. So fibrous tissues and all these seeds are there surrounding area. But here, what are the main symptoms of prostate cancer? Number one, frequent urination, especially in the night. Frequent urination, painful and burning sensation in the urination, difficult to start and stopping the urination. These are the symptoms. And last is blood is coming out through the urine or semen. These are the main symptoms. 4 symptoms are there. And there are some differentiation. Like, mostly in adult, after 50 years, mostly men complain that I have to visit at least 4 to 5 times in the toilet after 50 or after 60. Once you age, prostate glands becomes larger and larger. It grows, larger and larger. 50 to 60, 60 to 70, 70 to 80. But prime time, what is the prime age of this prostate gland? After 80. 80% people suffers from this. After 80, the aggressiveness is more.
But what is it due to?
Due to all the factors, responsible factors are diet.
Okay.
And which type of diet? That is next point. I will come to that point.
Okay.
Which diet plays important role, particularly to develop this cancer. So these are the main symptoms. And enlarged prostate, and prostate cancer. Now, as you age, your prostate gland will be enlarged gradually. And sometimes, you feel the same symptom. When you press this bladder or urethra, you can feel the same type of symptom in prostate cancer, even in prostatitis. But here, this is a benign prostatic hyperplasia. What is it? That is called BPH. That is a short version of benign prostatic hyperplasia. Benign, that is mild form. That is not a malignant form. Mild form, but symptoms are same. And this enlarged prostate, that is called hyperplasia. Hyperplasia means enlarged, hypertrophy. That is called enlargement. Yeah. So benign prostatic hyperplasia is the one symptom, and it is controllable, it is curable. Benign prostatic hyperplasia. Second is prostatitis, inflammation or infection over the prostate gland. Sometimes patients feel fevers and some burning sensation in urine. This type of symptoms in prostatitis patient. but that is not prostate cancer. That is also curable. Prostatitis and benign prostatic hyperplasia with the help of medicine, it is 100% curable, and it doesn't affect. It cannot. Progress into this particularly prostate cancer cannot reach that level. Now, diet. Which diet plays the role? Particularly which diet? See, dairy products. Dairy products, but which dairy products? Dairy fat, not dairy fat, animal fat. Dairy fat, not animal fat, particularly red meat. Those countries who are consuming more red meat and less fruits and vegetables, they are going to be culprit of this prostate cancer. So, all the foreign countries, mostly, these are the main reason that prostate cancer development, and it becomes harmful to the body. So those people who are consuming more and more red meat or any animal fat, so
Chicken, fish and all also.
yeah, whatever form in that particularly that portion, they are the main yeah. So that is the risk factor, but you can control that risk factor. It boosts up on the hormonal level. See that red meat is very dangerous. Animal fat. Whatever form you take this animal fat, this is dangerous. This boosts up male hormonal level. Red meat. There are some myths about prostate cancers. Excessive masturbation. People say that excessive masturbation is also harmful. It develops, there is no any relation with this prostate cancer. Vasectomy, removal of the pores. You see that family planning operation. That is not the cause for this prostate cancer. This is a myth. So that is not related to this prostate cancer. No masturbations or this vasectomy. That is called vasectomy.
Oh, is it because of less of sex, the semen collects into that thing? I heard somewhere that because the person is sexually dormant.
No. See, yeah, enlargement is there. Sexual, see, whatever you are doing, sexual intercourse, prostate enlargement is there.
Okay.
But not that
That extent.
You cannot reach. So this is a myth. Some people believe excessive sexual intercourse is related with this prostate. No, not at all.
Well, absent from sexual.
But yeah, it is harmful. Excess, sometimes you have to pass urine 4-5 times in the night. If you do excessive anything, like diabetic patients, they have to pass urine 4-5 times, 3-4 times, they have to wake up each and every time. Even in this prostate enlargement, you have to pass 3 to 4 times. So there are the frequent urination, earlier I told you, especially in the night. This is the main factors responsible. And what are the tests, how we can identify that prostate cancer is there? There are some tests, some clinical tests, some non-invasive tests like DRE and PSA. This is a very important test, but this DRE and PSA. What is DRE? That is digital rectal examination. When you go to your doctor, doctors, when you visit his consulting room, he will examine through this anal route with gloved finger. He will insert, because the back passage, rectum, is very
Close to that.
prostate gland is very close to the back passage, that rectum. So he can see the hard bump. If it is hard bump, then he can detect, yeah, it is cancer is there. If it's not, then no. Then he will go for this prostate specific antigen test. That is blood test of prostate specific antigen. This is a protein which produced by prostate cells. Prostate specific antigen. This is PSC, this is blood test, and what is the normal range? So 4 nanogram per milliliter of blood. That is the normal range of PSA. When you visit any urologist, they will say you go for this test, blood test. And that pathology will say, yeah, it is 4 or 5. But if it is beyond 4 or 5 or 10, then you will say, yeah, that you have developed this prostate cancer aggressively. Sometimes if it is less than 4, prostate cancer is there.
Oh.
So that is not reliable. I mean, so physical examination is required. Sometimes if they say, yeah, it is more than that, if PSA is less, then what they will do? What other tests they will perform? They will recommend that now you go for this biopsy. Biopsy detects the cancer. What they will do? They will insert the needle through this scrotum, that area, and some tissues they will remove and they will check under the microscope, and then they will decide whether cancerous tissues are there or this is a plain. But that test finalizes. Particularly, this biopsy test is very important. That detects the cancer, not this one. Sometimes doctor can
Not
confuse
reliable.
or you can be confused that it is less than 4 nanogram and still I have developed. Yeah, it's possible. But best diagnosis is through biopsy. So remember that thing, biopsy. Now, non-invasive imaging. CT scan, MRI, ultrasound, these all tests are required for this prostate cancer. Why? Because at which stage this cancer has reached, there are staging. One stage, two, and stage 3. There are 3 stages. Number 1 stage, it's okay. It is within the prostate gland area. It has not spread. Number 2, still it is confined to that prostate. Yeah, it is enlarged, but still it is confined. Number 3, it has spread beyond the prostate gland. Beyond the prostate gland, that is risky, that is dangerous. Then what they will do? They will inject some radionuclide iodide inside this that material inside the vein through this arm, and then scanning, all the scanning photographs, CT scanning like that. But for that you have to wait 3 hours for particularly that scanning. And why they are doing this scanning? Because they wanted to see whether this cancer is spread to bones, spreading up to bones. Bones means entire skeleton. Whether it is to spine or your thigh, femur, that dye absorbs very rapidly in the bones. It means, yes, in particular area of that bone, they have spread. I mean, that is called metastasis. Metastasis, that is the 3rd stage, metastasis. So it is metastasized to that level. So when this cancer reaches at that level, then it is dangerous. Then you have to be very careful. 1st stage, it is within the gland. Within the gland, it is not across that gland. 2nd, yeah, it is enlarged, but still it is there. Not that much. And now 3rd, beyond the prostate gland. So it has spread. All the cancerous cells have spread all over the body. they have reached all the bombs. So this radionuclide dye, they will inject and they will see, they will take photographs. And for that you have to wait there, particularly 2-3 hours after injecting the dye. So you can read some novels or you can pass your time and then you take some photographs. They will decide the final, now this is it. Because metastasis is always dangerous. In cancer, that is the extreme stage, metastasis. So there is the last stage of cancer. And it damages organs also, other organs also. So be careful. Now prevention, what we have to do for prevention of the cancer? There are so many options, preventions and this management. Chemotherapies are there, brachytherapy, radiotherapies, hormonal therapy. In modern medicine, so many options are there. But that is permanent solution for this prostate cancer. All this therapy, does it work? What are the side effects? What is the side effect of surgical procedure? See, totally radical prostatectomy, removal of entire prostate gland, that is not the option. Yeah, it is surgical option. But then what are the side effects of the radical prostatectomy? Erection problem. You will lose permanent erection. At least for 2 years, you can't enjoy your sexual life finish. That is the number one. You can't control your urine, bladder. You can't control your bladder. That is another side effect, radical prostatectomy. So that is not advisable, that radical prostatectomy is used.
Yeah, for Ayurveda you should do.
Yeah. I will come to that. See, these are the options. Because in modern medicines, hormonal therapies and
Side effects are always there.
Side effects are, and the chemotherapy cycles, number of side effects, reactions, drug reactions, and ultimately you can't control and get pain, and you see, you can't control your urine. Your natural allergies that you can't control each and every time that you have to pass the urine. So now what we have to, which type of diet, which type of food advisable? Number one, management. Now this is management part. Food. That diet, particularly low glycemic, legumes, vegetables. Vegetables in the sense, which vegetables has a anti-cancerous property, particularly in prostate cancer, that is a cabbage, cauliflower, broccoli. These are the vegetables that you can consume plenty of. And then garlic, because garlic has witnessed for prevention and cure of this cancer. Garlic, you have to add in your diet daily, garlic and turmeric, fresh turmeric, both.
fresh turmeric
And garlic, both you have to add in your daily
गार्लिक
diet.
ऐसा कच्चा खाना है या वो
You can just fry it
Okay,
in
वो भी चलेगा.
yeah, but that is best. Yeah, fry, or you can just make pieces and you add in garlic.
and
Because
कच्चा
that has proved.
fresh
So all the research evidence says yes, garlic has proven that it removes all type of this.
And fresh haldi.
Yeah, fresh turmeric that you have to add in your diet. Garlic and with haldi. Because see, if you take less fruits and less vegetables, then again there is a problem. So plenty of fruits and vegetables you have to consume.
Which type, which fruits?
So all that blue, yellow color, blue color and green. So full plate of variety of
what is
fruits
the
and
relation between color and this?
see it, the relation is there, that it contains all the anti-cancerous properties. All these fruits and vegetables, yeah.
And is there any relation with
Yeah.
color?
Color is always, the relation is there because
Yeah.
there are some ingredients, some ingredients in the sense that ingredients lycopene, like say
Okay.
lycopene. See, tomato is the best, I tell you. Tomato, if you consume tomato
Okay.
regularly, it removes all these prostate cancer cells and it develops your healthy cells. Lycopene.
सुना है कि वो जो उसके सीड्स है वो जरा
Seed-
इसको प्रॉब्लम करते हैं
हाँ,
अपने
लेकिन यहाँ इसका कोई प्रॉब्लम नहीं है.
ओके पर्टिकुलर
लाइकोपिन जो है दैट इज बेस्ट इसके लिए. दूसरा एक 100 पाल्मेटो एक आता है कोई पाल्मेटो. उसका कोई इतना मतलब रिसर्च या तो एविडेंस इतना मतलब नहीं है कि वो कितना इफेक्ट करता है, लेकिन ये टोमेटो
इज वेरी गुड.
tomato is very good. You can add in your daily diet this tomato. Tomato is not harmful, particularly this prostate cancer patient, because lycopene is there. So there is an anti-cancerous property. And here, indole 3-carbinase acting. Indole 3-carbinase. You see, this is answer to your question. Indole 3. Indole 3-carbinase. This is anti-cancerous in vegetables, and so all the green vegetables which I just spoke, that cabbage and broccoli,
Cabbage,
that
broccoli.
this contains indole 3-carbinase.
ओके.
That is the thing. Is acting as a powerful and androgen and proven to fight the production of cancer cell in the prostate.
ओहो.
This,
Fruits.
yeah, this, yeah.
So this is
That is very
available in
important, yeah.
fruits and vegetables.
Yeah, anti-cancerous properties, this anti-cancerous properties. So, because see, male hormone is produced by that area,
ओके.
that gland. All the sperms produced by your testicles
ओ यस.
through this prostate, but
But
some
this
fluid.
indole 3 available in which fruits and vegetables?
Yeah, I told you, yeah, all the,
All.
yeah, that cauliflower, cabbage, broccoli, that garlic, that turmeric and tomatoes. Yes,
वेरी गुड.
you can
Good.
yes. So you can take that.
Yeah.
This is called low glycemic. Low glycemic. Doesn't I mean see, diabetic patient can take, I tell you. Haldi, you take. If you are having diabetes, you take haldi. Your sugar level gradually will come down.
वेरी गुड. वेरी गुड.
If you add in your daily diet this haldi, fresh haldi, you see the sugar level after 1 month, you check it out. You will see the difference. So that is very important. And now, this is food. Now, management, Ayurvedic management. Which medicines work particularly on entire urinary system, because this is related to urinary system. So according to Ayurvedic point of view, this cancer is called Karkatarbud. Karkatarbud. This is the Karkatarbud, and this is prostate is called Paurush Granthi. Paurush Granthi. This is the name in Ayurveda for this cancer. Paurush Granthi or Paurush Granthi Arbud. Arbud means cancer. Arbud, like mountains.
Karkar.
Grows like mountains. Arbud. Arbud means pahad. Yeah. So Paurush means prostate. That is Sanskrit. Paurush is Sanskrit name because all the classical textbooks is written in Sanskrit. So Paurush Granthi Arbud, that is called prostate cancer in Ayurveda. Now what are the treatment? What is the remedies in Ayurveda? You can write. There are so many herbs, but specially prepared medicines are available in the market.
Okay.
So you need not have to prepare at home. Number one, this is Varunadi Kata.
अच्छा वरुणाली
Number 1. Number 2 is Punarnavadi Kata. Number 3 is Bokshuradi Kata. Now what is the quantity, what is the dosage of particularly these three? If you give in combination, you take 20 ml, 20 ml, 20 ml, 2 times, 2 times, 2 times. 20 ml, 20 ml. After lunch and after dinner with same quantity of water. All three together. Same quantity of water, 20 ml, 20 ml, 20 ml, 60 ml. And with this medicine, now medicine, which medicine is helpful?
तीनों साथ में लेना है या सर
Yes, yes, साथ में, yes, combination, yes. All
Saradi, this
Gokshuradi, Gokshuradi. Gokshura,
गोक्षूर
Gokshur, Punarnava, Varun, all are working on all the urinary tract. Kanchinar Gugulu. Kanchinar Gugulu. It works on all type of cancers, tumors, this. Kanchinar, 3 tablets twice with this combination. Kanchinar Gugulu and second is Gokshuradi Gugulu. That is 2 tablets twice with this. So this correct the metabolism.
ओके
This
is
Gokshuradi.
it two times?
Yeah, 2 times after lunch, dinner with this combination.
All the three are to be taken. All are to be taken.
Yes, yes. 1, 2, 3. And these 2 medicines,
टैबलेट्स
tablets. You can break the pills and so. This is number 1. Number 2. Tablet Vasant Kusuma Karas. This is one tablet 2 times with honey. Vasant
Sorry?
Kusumakar. This is a little bit expensive. This stuff cost you around 1500 to 2000 rupees.
वसंत कुमार बस
Kusumakar, yeah. It works on diabetes also, it works on this prostate related problem also. And it works on male sexual dysfunction also. This is the
One,
wonderful. One with
One morning, one evening.
one, yeah.
वसंत कुसुम
Kusumakar, Vasanta Kusumakar. But average range is at least 1800 to 2000 rupees for 1 month medicine. So this is a sugar, it's a gold preparation.
ओके
It's a herbo mineral preparation. Vasanta Kusumakar.
तो रेपिडोल इससे ही लेना जरूरी है गोरा गांधी जैसे
Yes. And if blood is coming out from that with urine, then you can take this Chandrakalaras, tablet Chandrakalaras. Two tablets twice with honey and milk. See, mostly in Ayurveda, particularly Vata and Pitta is related with this cancer, prostate cancer. So, burning in the urine and pain, burning in the urine and pain, right? So, burning in the urine is Pitta, here Vata is related to pain.
ओके
So wherever you are feeling burning in the body, that is related to Pitta.
Okay.
And wherever you are feeling pain in the body, that is related to Vata. That is
ये साइंस है.
yes, that is the biological humors. There are three biological humors, Vata, Pitta and Kapha.
Kapha. Yes.
Kapha is separate. In Kapha, you won't feel that type of pain. No, there is no pain in Kapha.
अच्छा इसमें दोनों में ही
Yes.
है. Very good.
Wherever you are feeling pain in the body, you are Vata predominant person.
Okay.
And wherever you are feeling burning sensation, then you are Pitta. So Chandrakala Ras, it minimize that burning,
Pain.
that pain effects, no pain. This
ये भी महंगा है सर. चंद्रकला भी उससे कम.
with honey and milk put out.
नहीं नहीं. वसंत को कुमार
कुसुम.
इससे ही
हाँ.
महंगा है या?
नहीं, that is not costly. Chandrakala is not costly. And you have to correct the metabolism, because main thing is metabolism. All type of cancer needs metabolic purification. That is very important.
इसको कैसे करना है?
To metabolic purification means panchakarma therapy, detoxification therapy. Improve the digestive fire. That is very important.
Metabolic purification.
हाँ.
Panchakarma.
Panchakarma, that is the remedy. Digestion power, improve the digestion power.
Yes.
And when some patient feels burnings, you see, we give this Chandrakala, we give this Sutta Ras, tablet Sutta Ras, because mostly prostate cancer patients are Vata and Pitta related complaints. So Sutta Ras is there. This is also good for this one with milk or plain water. And with this avipattikal powder, you can give in combination these two. That is 1 teaspoon twice a day with water.
For burning is Sutta.
Yes, Sutta and avipattikal in combination you can give. And you can give Chandrakala also, you can take Chandrakala also. So,
Avipattikal powder.
avipattikal powder. Tablet is also there, it is available in the market, Ayurvedic shop. This Sutta Ras, the gold preparation and plain, both are available, but this is cheap. Plain is cheap, gold is costly. That will cost you around 1,200 rupees. All the gold preparation in Ayurveda is very, very expensive,
But effective.
very effective.
Gold
And,
preparations.
prompt result, prompt result.
Gold preparation.
Gold, all the gold preparations. So these are the management. Now next, this is Ayurvedic management of this prostate cancer.
You keep these things? No.
Yeah. Last time one patient visited. When he listened my lecture, he came to my consultation. He said, "Sir, I want to keep my PSA level at normal level." I said, "Fine, okay, no problem. You take this medicine. I give all the medicines, and you take all the kadas from the market. It's a ready-made preparation." He said, "Okay, fine. But are you sitting in that Bombay side or no? Then he said, "Because I can't come over here from Baikala to." I said, "Fine, okay. You stay there. I will send all this medicine to here. Not an issue." So he has already taken. Now after on 28th, he will give me.
What are you are having? Will you prepare or you buy anything?
No, I prepare all these herbs and then
Gold thing you have.
yeah. Now Yogasana. Sarvangasana, Sirsasan, Ustrasana, Sinhasana. These are all yogic postures.
Sarvangasana second.
Sinhasana,
Sinhasana.
Sarvangasana, Garudasana, that Garud posture, Garudasana, Sinhasana, Sirsasana. So these all asanas are very effective for prostate cancer patient. And pranayama, Vastrika, meditation, all the yogic breathing exercise that you do it regularly and do it in the morning. This all the asanas and exercise, breathing and all this, you have to
Okay.
do in the morning, early morning.
Okay.
It will give you energy and boost up your confidence level.
Yes.
That is
That
very
is
important.
important.
Which one?
This all the asanas which I mentioned,
Hmm.
that you have to do in the morning daily. So these are the things. Any more questions?